Welcome back to this episode of This Healthy Life podcast. I'm so excited for my guest today. I have Vanessa Salazar, who is also known as Team Plastic, and she specializes in post-op lymphatic drainage support. And she's here to share all her wisdom on how to heal post-op, especially from lipedema surgery. So thank you, Vanessa, for joining us today. So excited
for having me.
Of course. So excited for you to share this super important information that a lot of people overlook in their health journeys. So
Absolutely.
Welcome.
No, I'm so glad to be here. I feel it's not talked about enough. I feel it's definitely an up and coming therapy post-op. So I'm glad. I'm happy that we're here.
Awesome. So I'd love for you to start with a brief intro about yourself, how you got into this type of work and what your specialty is.
Yeah. So I've been in the plastic surgery industry for about 10 plus years. I started as a consultant and I was doing medical tourism in Colombia, consulting for surgeons out in Colombia, traveling with my patients. And then I found myself kind of in a tight spot because I didn't have anybody to continue the post-op care here for my patients. In Colombia, South America, Brazil, all of that. Lymphatic drainage is really important. It's included in the package price. It's just included in the surgery that you have to follow up with the surgeon and then they have somebody there to do these. Here, the case wasn't so much.
And even today, right? Like they still
even
don't
today,
really continue
it's for a lot of the surgeons in my network, they're recommended. I have 2 that require them, absolutely required, but the rest, it's all recommendation. And it's just, I'm not saying that they don't, but it's just generally, it's not given the importance that it really truly deserves. So when I kind of hit that bump in the road with the post-op care here, I got into it and I kind of just decided for myself that I would train there. And then I came here and got certified here.
Amazing.
States. Yeah.
Awesome. So let's just start with the basics. Let's talk about what exactly is lymphatic drainage after a post-op and how is that different from, say, going to a spa to get a lymphatic drainage massage?
Right. So the difference I would say between a lymphatic massage and a lymphatic drainage is that with the lymphatic massage, I find that a lot of the times, and everybody does it differently, and I really want to clarify that because everybody's technique is differently, but we all end up using the lymphatic system, right? The difference with post-op is that we are taking the area where you had the trauma, where your procedure was, and we're using a little more pressure to kind of move all that excess fluid, and especially because you're swollen, and we're kind of using the friction to create heat and allow all that excess fluid to go into your lymph nodes. Because at that time, your body's just shut. Your lymphatic channel is shut. Your lymphatic system is just shot. It's overwhelmed. So we're kind of giving it the motion that it needs in order to keep it flowing after surgery. And that's a little different than going to a spa because when you go to a spa, I find that they focus on just clearing up your lymph nodes in order for your body to do it itself. After surgery, it's kind of hard for your body. And actually, a lot of spas won't even treat you with open incisions. They won't treat you with fresh scars. They'll have you wait. So that's kind of really the difference. And I really also like to tell people, whether you do these with me or anybody, these are important to follow up as long as you know the difference between post-op and then a lymphatic massage.
Yeah.
It's a little different.
Absolutely. Yeah. Your body just went through major trauma, getting, they use a different fluid to numb you and everything. So you're extremely swollen. Plus the swelling from the surgery itself. So there's a lot of swelling that needs to go down.
Absolutely. There's tumescent fluid that's in you, your post-op body, everything that your body just went through, it's just overwhelmed. And right now it just wants to hold everything in.
Yep. So. Absolutely. And so if someone is having surgery, how soon after surgery do you recommend starting the post-op care and starting the post-op lymphatic drainage?
My personal recommendation is to begin 2 days after surgery. Okay. With major surgeries such as tummy tuck, which it's different than lipedema surgery, but I am a post-op specialist, so I do like to stay. Typically, we start 2 days afterward. I also do follow doctor instructions. Some surgeons like just different things, and I respect that. I never overstep, but generally, typically, 2 days after surgery will get you in a good place. It's a good place to begin.
Yeah, and I want to add, you think that, hey, I just had surgery, I'm going to be so sensitive and tender in these areas, like I don't want anyone touching me, but these massages actually bring a tremendous amount of relief because you're so swollen and you've got all this extra fluid in you and you're just stuffed in this compression and you're so miserable. So like the massages were like the one thing that I looked forward to on a daily basis after my surgery, just to kind of give temporary relief, right? Give your body a little help.
That is the number one concern amongst all across the board with all of my patients. And I think that's where my own personal experience, because as you know, I've obviously had, I've been through my fair share of surgeries, but I think that's where my personal experience comes in, where I can empathize with that. So I know how overwhelming it can be to think, I have to take off this garment. She's going to touch me. She's going to massage me. Right? And we're thinking the worst.
Yeah,
we're
absolutely.
Thinking they're going to squeeze. They're going to hurt me. My scars are fresh.
You're bruised.
I'm bruised. Like, you already don't want to even breathe too hard because you're feeling like you're going to explode.
Exactly.
So people are thinking, why in the world would anybody put their hands on me? But like you said, the amount of relief that you generally get from these, there's just no explaining it until you've gone through it.
Absolutely.
So, and I'm so glad you brought that up, because it is so important to also shine light on that, right? A lot of people think, no, like I'll just wait. They're thinking that waiting will make it better.
I'll wait till I'm not bruised anymore, but that's like the worst thing you can do.
That's the worst thing you can do. That's the worst thing you can do. And this will bring you relief.
Yep.
This will absolutely, you'll move a little better. You'll everything will feel better.
Yeah. And I also want to add that the sooner you start, the better, because there's kind of a process that goes on during your healing where everything kind of starts to harden, right? Like it starts off as fluid and then it gets harder. And so the sooner you start those massages, the sooner you get that fluid moving and moving out of you, the sooner you're going to find relief.
There's phases of recovery, and the hardness is a natural, I want to say side effect. I don't want to say complication, but it's a natural phase of recovery for the hardness to start. I just like to start before that, just because we want you, if you're going to harden, we want your body to do it as evenly as possible so that your body heals as evenly as possible. We don't want any bumps or lumps. You know me, I will drill it to the end, but no bumps, no lumps is my kind of
no
logo.
indentations.
No indentations, none of it.
Which we're going to talk about here in a second. Before we dive into that, I want to just shine a little bit more light on the post-op. So if someone's just had surgery, starting right away is critical, and within 2 days or after 2 days of surgery. And then how long should people expect to kind of build this post-op care into their routine? I know with like recovering from lipedema surgery, you're always going to have some issues with, swelling and water retention. Lymphatic drainage is going to be kind of just like a permanent fixture in your life. Obviously not to the degree of having to do it all the time right after post-op, but if someone's just post-op, what do you recommend is a good kind of like longer term care plan that they should integrate this in? My personal experience with all of the patients that I've had and all across the board is that prepare to have at least the first 7 to be consecutive and as often as possible. Even if you can space it out every other day at the very least, that's a good place to put you at. Now, after that, I always tell patients, follow what your body is telling you. If you're kind of swelling more often than you would think, if you're tight, if you're still feeling that pressure, if you're still feeling that tenderness, it's important that we still go in there, because that means your body's just still not fully recovered. Obviously, swelling and hardness, as I said, are natural phases of recovery, and it's normal to be there. We just want to make sure that your body's going to do it as naturally, but also as seamlessly as possible. Again, I cannot say it enough, no bumps, no lumps, no creases, because it is crucial, especially once the hardening starts. We had an issue, the garment, if it lands in an area where you're hardening and it's not a natural crease of yours and it creates its own, well, guess what? You're stuck with that crease. You're stuck with that indentation. That's why you'll see a lot of women that probably think wearing a tight garment in their tummy, like, oh, the smaller the garment, the smaller the waist. That's not always the case. And it causes for creasing that sometimes you just get these dents from. And those are hard. You can never get rid of those.
Yeah, those are, you can, I mean, you could in some cases, but in a lot of cases, sometimes you need surgical intervention or you need, you know, just to deal with me for the rest of your life.
Job security.
So there's that. But you know, that's never the point. The point is always that we stop seeing each other because you've recovered. Exactly.
Absolutely.
Yeah. But in cases like, you know, like lipedema or lymphedema, we're going to be best friends. So that's just how the cookie crumbles.
Yeah, absolutely. So we've talked a little bit about some of the complications. So let's talk a little bit about how this hardness happens or how this creasing happens, because I want people to be really clear on what kind of causes those issues and what to look out for if they are dealing with that.
So that's the way I best explained it. Yeah, the way I best explain it is that when you undergo a surgical intervention, like liposuction, the cannula creates tunnels, and those tunnels are considered scar tissue. And we want to make sure that in the beginning, we try to make it so that if it's going to be created, because we can't avoid scar tissue, it's part of the process, that it does become even, or that it's as soft as possible, as we can't really see it. You know, we know it's happening, but we're going to try to avoid its visibility as much as possible. Now, the thing I like to look out for is when you put on garments and they, like I explained, they're not landing in an area where your body has a natural crease. The best way to approach it would be to go always, but always ask your surgeons, because surgeons like different things, add foam. I feel like that has always been my
buffer.
Break the glass. Break the glass in case of an emergency. Grab the foam. Because those creases will be put onto the foam and not your skin. So I've always felt that, as you know, that was always my way of dealing with it. Like I said, the hardness is almost inevitable. You're always going to go through it. It happens. But that's when post-op care is most crucial, because we want to keep an eye on it and make sure that it's even, that it's treated properly, and that it's going away.
Yeah, absolutely. And the foam, if you're planning to have surgery, especially torso surgery.
And if you are my patient, we are going to use foam.
Be ready to be wrapped in foam and then stuffed in compression. But you'll be so happy with the results if you do it correctly.
They're good.
Yeah.
It's good. I mean, I know we suffered, but I think for me, when I wore my foam for like 3 months,
You're crazy.
My mom was looking at me like, why are you still sewing yourself? Like, you're okay. You just never know.
Yeah.
You never know. So if in doubt, add foam.
Awesome.
Period. Yeah.
All right. So we've talked about hardening, lumps and bumps, and creases. What are some other common mistakes that people make when they're recovering from surgery?
I mentioned the garment. A lot of people think that wearing a tighter garment will help, but in some cases that could create, like I said, the creasing, the indents, in some cases seromas, you know.
So let's talk about what a seroma is, because that was actually my next question, so we can segue right into that.
A seroma is a pocket of fluid that's built in the area where you have had your procedure. The skin is obviously not hitting your muscle. I mean, not your muscle, but the skin's not attached yet. But so fluid builds there. A lot of times when they're small enough, your body will absorb it. When your body is just so overwhelmed, and when it's a considerable size, it does need to be removed with needle aspiration. And the way I kind of allow patients to detect them is if you go to touch it and it feels like, or it looks like a wave, you go to touch it.
Like a water bed.
Like a water bed. Like a water bed. And typically you will need to contact your surgeon or your PA, whoever's treating you, and they will need to do the needle aspiration. There are clinics that will do it, and if you have access to them, great, but a lot of places will not touch another surgeon's work, especially when it's plastic surgery. So it's however, I do want to say they're not dangerous.
And they don't hurt either. You absolutely don't feel them. The only thing, the way you notice them is, like you said, if you see that fluid kind of moving around, but otherwise you don't feel anything.
And it can be hard. They can be hard to detect because after surgery, you're dealing with soft tissue as well. So you're like, is it not? So really the way you'll most likely see it is everything around it will be really tight. And then you go to poke that one area that just is a bubble. And like I said, when it's a considerable size, it does need to be needle aspiration. But in some cases, your body will absorb it if it's small enough. But like I said, it's I don't even like to call it a complication because it's an easy fix. It's tedious. It's very annoying because sometimes they don't go away in the first aspiration when they're big. So they don't go in the first time and they can come back. So they are tedious, but I never want to call them a complication because once they're fixed, nothing, you would have never known that.
Doesn't do any damage to your results or anything.
No setback. No.
Absolutely. All right, so let's talk about how long it takes to kind of achieve your final results too. So I think a lot of people think that liposuction is just a quick fix, right? Like you're gonna get the surgery and you're gonna go right back into the gym and you're gonna look perfect, but really it's really about a year-long healing process to heal from the procedure. And if you have lipedema, probably even longer because you had so many other underlying health issues kind of complicating that with like the swelling that you were getting on top of the surgery swelling and, you know, just all the inflammation from lipedema as well. So kind of walk us through the year of what that healing process looks like and what kind of the stages of healing are.
I always tell my patients, and that's really regardless of the procedure that they have or the size or whatever it might be, I always like to tell my patients that you can expect to start to see results within 3 months. That's when you start to see what you've done. Shape. Exactly. And that's even from personal experience. Every single time I've had a procedure done, I don't start seeing the results of it 3 months in. And maybe that's just a placebo effect.
You're like, I see it.
You say it enough, you start to fake it till you make it, right? You say it enough, you start to believe it. But really, like, I think even surgeons will tell you 3 months is kind of when the swelling begins to subside and you start to see the shape of what's happened. 6 months is when final results start to set in. That's not it at all. But usually if you are thinking about a revision for whatever, like, this side looks not quite the same as the other side, or this arm looks different than this one, or when things start to look different. And at that moment, if you are not healing evenly, a lot of surgeons will consider thinking about a revision. That's when the conversation begins, because that's when final results start setting in. At the year mark, though, is when this is it, really. And that's when a conversation can be had about, like, this is not what I thought it was, or this is everything that I imagined it would be. And I see that more often than not. So
that people are happy.
Oh yeah. 100%. Yeah. There's I want to say maybe 2 out of 5 will go in for a revision. For revision. Now, let me tell you, plastic surgery, I always say there's 4 steps. There's regret, accept, forget, and repeat. Like, it just seems to be the trend. We regret it initially, and then we are like, fine, okay, I did it. We're accepting. And then we forget how painful, you know what, it didn't hurt that much. Wasn't that bad. It's like your mind kind of blocks it out, right? Wasn't that bad. And then, you know what, let's just one more round. But yeah, that's really the timeline. 3 months is when the swelling subsides a little bit. 6 months is when final results are setting in. And then the year mark is when we're happy or we're not. But
No,
more likely.
I totally agree with that timeline too, because as people out there are going to find out or know, I had 4 surgeries last year and it was the same thing, right? Like you have the first surgery and you're like, this is so miserable. Like, how am I ever supposed to do this again? And you hate your life for like 2 weeks. You're so swollen, so miserable, so stiff. And then all of a sudden you just like turn a corner, you're like, oh, okay. And then like, you're like, wow, I'm like starting to look pretty good. And then like the swelling starts going down and then all of a sudden there you are again. You go through the same process.
It wasn't that bad. But here we are.
Absolutely. So let's talk a little bit about compression. So compression, we talked about the things that can go wrong with compression, you know, like wearing something that's too tight and things like that. But compression is actually really important after surgery. So let's talk a little bit about why it's important to wear the garment, how long you should probably wear the garment. I know every doctor has kind of a different protocol for it, different timeline. But let's talk about the importance of the garment and how to make sure your garment is fitting correctly.
So the way I like to base my garment is we're especially in phase 1 of recovery, which is the first 2 weeks, we never want a garment that we see girls wearing with the really small waist and like, we're not doing that. We're like right now, that's my own personal opinion. That's my personal take on it. And all my patients are beautiful, but I don't think that that's what's important phase 1. I think in the beginning, what's important is to compress the area affected and to control the swelling, because having a too tight of a garment on will cause the complications or kind of the discomfort that we talked about in the beginning. And for me, and we experienced that too, too tight of a garment will cause areas that we don't want to create. Just things that we don't want to create. I feel it's most important just to find a garment that's going to compress the entire area and then some. Because what happens is that when we find garments that are going to only compress the area where we had the procedure, but we let the other part just hang out, the swelling is going to happen in other areas. And even though it might not set you back because you didn't have your procedure there, it's uncomfortable. The circulation is off. So we definitely just want, in that phase 1 of recovery, it's just definitely important just to compress the area and then some. We're not looking to have that really tight garment because to shape and mold, yes, it's important, but it's more important to be evenly compressed to avoid circulation issues, to avoid creasing and indentation. And in the beginning, when I first started, in the industry, that was my misconception too. Wear the tight garment, make my garment tighter, give me that really small waist. And it wasn't until further on with my own personal experience that I just realized, you know what, compressing, it really is just the key to controlling the swelling. Because if we're not controlling the swelling and we're like, just focusing on other things, then what are we really doing?
And do the garments, especially that early on, even contribute to your final results, or is it really just about controlling the swelling with the garment? I mean, is it also helping to shape, or?
That there's lots of doctors that don't even believe in garments doing anything after the first month. There's plenty on my, network that release you from your garment after a month. So that says a lot to what is it really doing to your shape? You know what I mean? Especially for lipedema and lipedema surgery, a lot of women aren't even looking for the shape. They're just looking to fix the issue.
The swelling,
Do you know what I'm saying?
Absolutely.
So it just...
and they're already kind of used to wearing compression before the surgery oftentimes as well.
Exactly. So a lot of the time, that's not even the issue. I just like to shine the light on, great, if you want to wear it, that's great. Just look out for those things that we mentioned. Circulation is important, and no creasing is important, because those are kind of things that we can avoid. It's just such an easy way to avoid those things by just wearing proper garments that
and being conscious of like how you're sitting too, right? Because like with my arms, I had a tight garment on, and I always had my arms bent on my phone or something, and I was getting creasing.
Yeah, but it was too tight. Yeah. And you know what? I don't shoot the messenger, because I'm not saying that I don't believe in these garments that like cinch you and give you this beautiful shape. I wear them. I told you, I still wear mine.
You're crazy.
Yeah, no, I still wear mine. And it's one of those.
No,
it's
it does
one
kind of reshape you, yeah.
Yeah, it absolutely does. But I just don't think that in the very beginning, when we're already so uncomfortable, when we're already so overwhelmed with everything we've done, that they are as important as just having compression is. Yeah, that's important.
Yeah. And then also not risk causing those issues by being too tight in the beginning too, right?
It's just not, I mean, you'll have plenty of time the rest of your life
to wear the tight ones.
To wear the tight
when you're
ones.
actually leaving your house, when you're actually leaving your house and care about your shape, right?
Like those, but when you're only gonna see me, you don't need to have this little waist trainer on. Yeah, that's a big one too. Yeah. I know a lot of women that think that, you know, they'll ask me, oh, can I put on a waist trainer? Now is not the time. Now is not the time. Oh my God, please don't wear a waist trainer after your surgery. It can be so damaging. Yeah. Those are setbacks. Yeah. Those are true setbacks.
So what happens if someone does have a garment that's too tight or gets a crease and things like that? Like what sorts of tools do you have that you can
Massages will help fix those creases, as you saw. They'll help fix those creases. Sometimes though, when they're so embedded or when you've just let it just create and exist and form and go on and on and on, sometimes you need surgical intervention to kind of break that scar tissue that was created. So yeah.
Don't wear your garments too tight.
Don't do it.
PSA.
Don't do it. I'm here to serve you.
Otherwise you're going to have an over every day.
Yes. Yeah.
All right. So I want to shift gears a little bit now too. So let's talk a little bit about the plastic surgery world in general and how there's this kind of stigma or shame that if someone gets plastic surgery, people kind of just assume, oh, they're taking the easy way out, which we've already covered is not the easy way out. And then even in the lipedema community, which is someone that's suffering with like body dysmorphia and feeling comfortable in their body, and that liposuction is the solution to lipedema, still gets a lot of shame, especially if you're concerned with aesthetics and how you're going to look afterwards. So let's break that down. You've had a lot of experience in this world. What do you think is going on there?
So I started my journey with plastic surgery when I was only 19 years old. I decided at 18 that I was just going to, lose weight. And I did. I lost about maybe 45 pounds at 18, all on my own, just cutting off like juices and sodas, and I just did it on my own. But there were parts of my body that just weren't looking the way I wanted. And I decided that I was going to have surgery. And I'm not going to take you on my road down memory lane, but that's when I started, when I was 18. And all that to be said, that when I decided to get into the industry professionally, I saw that there was this battle between doing things the natural way and then doing things this way, which is plastic surgery. Now, which is why I decided to call my business Team Plastic, because I do want to kind of take away that negative light that's kind of shunned on plastic surgery, because it is in no way the easier route. And I say it from having been on both ends of it. I did it the natural way, and that wasn't easy. But I did it this way also, and that wasn't any easier, because as I've talked to you about it, to gain weight after you've undergone liposuction, your body is not responding to that weight gain the way you would have responded before, pre-op, right? The science behind fat cells is that it needs other fat cells to survive. So if you lipoed your abdomen, your tummy, and you didn't do your arms, guess where that fat is going? It's going to
find all the other places.
Exactly. Like I said, I began getting surgery at 19. I had my babies after that. I was pregnant with the smallest little tiny belly, but everything else looked like I was carrying my child in my arms. It's insane. Yeah. So to not only have to just deal with keeping the weight off, you have to take care of what was done, you know? So we're already dealing with like massages and garments and keeping up our protein. That was important. And water and all these things. But then you have to make sure that we don't gain that weight back. Because if we do, it's going to be a disaster in a lot of cases. That's why you see a lot of women with like, you know, that have had surgery and then you see that they have really big arms or really big legs, or, you know, like why is their stomach so flat? Exactly. Because we are just not taking care of our bodies post-op. This is in no way an easy fix.
And it's not going to turn off your weight gain either, right? Like I think that's something that people need to realize you just because you got lipo doesn't mean that you have to stop eating healthy and stop going to the gym and stop doing all these things that are like healthy and important.
Most important.
Anything, exactly. And if anything, you have to do it even more.
And I always say that, like, you have to literally, yes, liposuction is incredible. It was a lifesaver for me. I love it. However, you have to make the lifestyle changes. This is in no way the easy way out, because you still have to do the work. You still have to maintain the results. You still have to show up for yourself and keep up with what comes after that. Because even though you didn't do it naturally, that doesn't mean that your body knows, okay, well, you did that, so now I'm not going to let you get, no, your body's not going to do it for you. You have to do it for your body. And that's what's important.
So reminder, it's not the easy way out. And then, so I want to talk about another thing that I noticed too. So obviously before I had my surgery, I looked at a lot of doctors, a lot of pictures of pre and post-op like liposuction results to select my surgeon, right? And so I'm noticing this trend that there's a lot of influencers, men and women, and you know, they're like, buy my program, buy my supplements, and you can look skinny like me. And they show their before and afters. But I'm like, that really looks like they've had some surgery, right? And I know I've sent some to you, and you obviously have an eye for it because this is what you do and you've looked at every day for the past 10 years. And so I feel like, you know, I think part of it is this stigma of shame around plastic surgery, that people don't feel comfortable that they can be like, yes, I had surgery and I'm happy in my body now. Like there shouldn't be shame around it. And then part of it is like, what's with this like secrecy and kind of tricking people when they're not being authentic, right?
So, you know, that is probably one of the most frustrating parts of this. I will never, ever in my life tell somebody to disclose medical procedures, ever. I will never. But I do not like that people with platforms of such, I'm not saying all platforms, because you can be in any industry and do whatever you want. And if you don't want to share, absolutely don't share. If I weren't in, but it's like me. It's me sitting up here and telling you, oh, let's just do it this way or that way, because I've never had any surgery. And it's not authentic. I wouldn't feel good doing that to you. But that's how I feel. People with the platform that have gone through these things and know how hard it can be, not to encourage people to be open about that experience, you know, because that's what's adding the shame to it, right? That you're feeding this negative
stigma of it.
And
then it's like you said, like, I don't care if people don't want to disclose that they've had it or not. That's right. But don't pretend you haven't had it and try to sell a product or a supplement to say you'll get those results when those are surgical results. If you don't want to share that you've had it, I am okay with that. That I have plenty of people that I will take your secret to the grave. That's total. I support that. I support that because you shouldn't have to. However, when you sit on a platform and you tell the world that, oh, well, I did this with this supplement and this diet plan and this exercise. And you can buy it for $9.99.
What? We just talked last week about, you know, like that's so... It's sad. It's frustrating to me because if you were to do it, how discouraging would it be for you if it didn't work for you? Especially when somebody's coming to you with, this is a perfect example, somebody with lipedema. I'm going to out my mom and she's going to be okay with this. But my mom has tried countless amounts of things for her, you know, situation. I'll lose weight this way. Well, she lost weight. Look her example. Look at her advertising. She did it. Why won't it work for me? And it's because it wouldn't, right? It wouldn't work for you because that's not how they achieved that.
Exactly.
So it's discouraging because it puts people
that are already struggling with their body image and feeling good in their body. Then they try this hoping that they're going to look like that.
Especially
and those aren't even going to, it's not going to get them close.
At a dead end. Especially people that, you and I both know that when a lipedema case is just too severe, there's no, it's only going to get worse. You can't really kind of backtrack on that. Once it's reached a point, there's no going back. So for that person to come to you and say, oh, let me try your products because absolutely, this is totally going to help you. No, that's not what's going to help. So like I said, I'm not saying that this way is the only way. And I'm not saying that the natural way is the only way. I'm just saying that everybody's body is different. And it would be fair to just give everybody that fair chance to find out for themselves that, okay, I can talk about this. This is okay. It's not, you know, like she did it. I can do it too. You know, that's a better conversation.
Absolutely.
I feel.
Absolutely.
Yeah.
Awesome. So we have time for one final question.
Yeah.
So if someone's just kind of getting started on their surgical journey, what's one or two pieces of advice that you have for them as they kind of start this year-long process of healing and recovery?
And what I always told my people when I started as a consultant is to not focus on just results. Focus on a surgeon that works with people that look like you and give the results like you're looking for to have. Because, for example, you and I have very different ideas of what we want to look like. So I am not going to go to a surgeon that doesn't work on bodies that look like mine and expect results like this other person. Right. Does that make sense? So that is my number one tip, is to find a surgeon that's going to work with your body type to give the results that you're looking for. That's really utmost importance. And don't forget your post-op. If you cannot find a way to do your post-op, you should not be getting surgery. Post-op is probably just as important as your procedure.
I agree.
Yeah, 100%.
Amazing. Awesome. Well, if people want to find you and book a session here in LA, if they're starting to have surgery, how can they find you?
You can find me at teamplastic.org and you can book your consult online. I have all of the ways to reach me. My email and my phone number are listed on there. And I do not do social media. So the best way is going to be through my website.
Perfect. And we'll link to it in the show notes as well.
Absolutely.
Amazing. Thank you so much,
Thank
Vanessa.
Thank you so much for having me.
Thank you.